Good afternoon, everyone, and welcome to the IAFC's presentation, First Do Community Connect for COVID-19 Response. My name is Jeff Doolan, and I am Strategic Advisor here at the IAFC. It's my pleasure to welcome you to this afternoon's webinar. We're going to learn about a new tool from First Do that's going to help you make your communities much safer. At this time, I'd like to turn it over to Andreas Huber, and he's going to take us through the presentation. Andreas?
Hey, morning. Good afternoon, everybody. Jeff, thanks so much for the introduction. And thank you all for joining us today. I wanted to just take a couple minutes before we jump in to frame what this program and initiative is really all about. It was really just about a few weeks ago that we started to hear from a lot of our fire department customers around the country telling us about how challenging it's been to, when they're on calls, tracking and managing COVID-19 related data, high risk occupant data, and overall, community members with functional needs. We kind of looked at that and thought, gee, we're really in a unique position to help solve for that. And so we've been on a sprint now since then, working with our partners, the IAFC and Esri, to build out the first ever nationwide self-reporting solution specifically designed to help our first responders know what they're getting into. And I think it's important to note as well that this is, in terms of size and scope of this initiative, it's not just a small product that you can use, today, here and there. This is really, we have a big vision collectively for this. This is something that's going to enable the public nationwide to self-report their health status as it relates to COVID-19, not just today, but also into the future. When we think about what our needs might be 6, 9, 12 months forward, this is going to serve as a vital component of overall infrastructure for communication to really help keep your first responders, better informed from a situational awareness perspective, but also provide better service to our communities. So this is stage one. We're going to be working very closely with everyone. We want to hear from you, your leadership, and especially your community on how we can improve the solution as we move forward. It's going to be a very fluid motion that we'll be in, and ultimately we want to sort of play our part in this coordinated battle against COVID-19. So I'm really excited to walk you all through this today. Rami El-choufani, our head of product, is going to actually give the demonstration. So I'm going to hand it off to him, and thank you again for joining us.
Thank you so much, Andreas. Hey everyone, I'm the head of product over at First Do, and like Andreas said, I'm going to kind of walk you through how this whole thing is going to work. It'll be kind of part education, part part introduction, part training session. But what we're going to do is kind of start with an agenda. We're going to provide a little bit of background on First Do as a platform and as a company, and kind of finish that introduction talking about the Community Connect module. That will segue really nicely into an introduction for Community Connect for COVID-19 and how that whole thing evolved, and kind of getting everyone to think about this a little bit more broadly than just saying, hey, I have, I've tested positive to COVID. Then we're going to jump through how it actually works. So I'm going to demo end-to-end how you guys get access, how you spread the word to your community, how you drive those resident signups and the sign-up process itself, and then how you actually access the data from a public safety perspective with your own public safety login. And then finally, we're going to just pass over to Dan Flynn, Division Chief over at Asheville, who has spent a long time with us developing and building out Community Connect well before this issue came about, and we had something that a problem we really needed to solve. But Dan Flynn has been working really closely with the city of Asheville, Buncombe County, as well as a bunch of other customers across the country, to have their residents self-report critical information to emergency response personnel. So in terms of a background to First Do, let's just kind of start with our mission. We're focused on ending first responder injuries and deaths due to lack of information. Pre-incident planning, incident preparedness has always been a massive challenge across public safety in general. And we really just don't have information on the buildings we respond to day in and day out, especially on the residential side. So we kind of built a platform that's an end-to-end pre-incident planning, mobile response, and community engagement platform that connects into data sources to give you pre-plans on occupancy management inspection pre-planning tool where you can go out and collect additional information, and then kind of wraps that all into a mobile response tool so you have access to that data at the time of response. But we noticed very quickly that there's so much information that exists at the resident level where they can provide critical information like functional needs, pets, access information directly to first responders. So we built out Community Connect, where residents can very easily log into a secure front-end platform and provide critical information from pets, access and utilities, functional needs information, contact info. It's constantly updated, and that information can be provided directly to your agency and accessible at the time of dispatch. Having this already in place, working around the country when the COVID-19 crisis kind of initiated and we started to see more cases, many of our staff are actually in New York City in the epicenter, we realized we're in such a unique position to essentially use this framework and platform that we have to help residents self-report critical information, everything from symptoms to positive tests to the fact that I'm high risk or have some sort of functional access and functional need that I'd like people to know about, and then have that available to public safety agencies when they're responding, but also from a data analysis perspective. So we made the decision to create this at-scale solution that can be accessed and deployed very quickly in a matter of minutes and free to agencies across the country. So this is something that we're doing as a attempt to really solve one of the major issues that we've had in a very long time. So what we're going to do in terms of a demonstration, I'm going to actually walk you through this kind of process. So let's jump into this landing page over here. So this is kind of where you guys are going to start. We're going to send over this link to everyone. This is the public safety landing page, which means it's kind of an information page of how this whole thing works and allows you guys to request access from the fire department, EMS, EOC, and law enforcement perspective. It just gives you some information. So if you wanted to share this internally, it explains kind of how this works, the fact that it's no cost. And everything kind of starts with driving awareness, pushing residents to this page that we're going to show you in a moment that allows them to learn and create a profile. So creating a profile takes minutes. They self-report information for their household. And then that data is made available directly within First Do and then also within ArcGIS so that you guys can analyze that data and use it for a bunch of different purposes. And we're going to take you through that entire workflow today from start to finish to show you how simple and easy it is to get started at zero cost to your agency. And this is just a few other components of information that you can use, the press release as well as the webinar recording when we have it up that you can share with people. And then obviously all the data information is 100% secure, is only used for the purposes of public safety and emergency response. So it's really for you guys and for you, giving you the ability to actually use this from a response perspective. So once I do that, I'll just come in here, put in my agency name, full name, role, and just create free account. You'll receive an automated email, and then within probably 24 hours, we will provide you this email. So this will be sent over with instructions on how to set up your account. So we'll verify you're a public safety user, a public safety agency, send you over the public safety side of the account. And these are just really simple instructions, right? So you can log in anytime and get started from the responder view. Now, it's kind of the opposite of how you would get things going, right? Because the first thing we actually need to do is getting your community to sign up and self-report. So what that means is, how do we share this to our residents? How do we let our residents know that this is something that they can access and provide this information to us and sort of educate them around it? So because Community Connect has been around for a long time, we provide you everything that you need to do that. Instructions, social copy, content that you can hand out in terms of print out in terms of flyers, all that sort of stuff, as well as the most important thing, this resident-facing landing page. So this is a link that is can be used nationwide across the US, and this is essentially the page that you want to share because you want to encourage them to report, explain how simple and anonymous this process is, and then letting them know that it's not just people who have tested positive. It's anyone who has exhibited symptoms. It's anyone who potentially might be higher risk, or even just have access and functional needs that would help first responders and emergency response agencies get an understanding of their community during this time of crisis, and really just anyone, even if they're healthy, right? So that's we're going to be pushing this on our own to residents across the country, but you guys will definitely have a role to play in getting this page out to your social media accounts, and that's a very simple thing to do. If I just reduce this for a second, I'm going to come across here. You see, I'm just in our First Do LinkedIn page, but it's on any of your assets, whether it's LinkedIn or Facebook. You just come and you press Start Post, and if you take that Community Connect COVID page and throw it into the post, it's going to automatically load the image and the link. So you can even take that out if you want to now. And then coming back to that little instruction document we sent to you, we even give you a bunch of examples of what copy you can do to post. So for this one, it's just about helping first responders. And you just throw it in and you press post. Now we have a bunch of other tactics and techniques that we'll provide to you guys in our best practice guide, and you can reach out to us anytime for help from our marketing department to get the message out to your community. But essentially the message is, go to this site, learn more, set up your profile so that we can know more about your household in this time of crisis. I'm just going to delete that post now, but kind of get the point. So coming back then to this landing page that we had here, let's assume a resident has come from that landing page and from that post, and is now ready to self-report. They've run through this, said this actually makes sense. Yep, I'm in these categories, which is everyone, and I want to self-report. So I click self-report status. That's going to take me to the sign-up page, which is a secure password-protected page where you can create an account. They can even sign up through Facebook and Google for kind of easy sign-up process. For me, I've already created an account, so I'm going to go to sign in. I just put my username and password. I press sign in, and that takes me to, again, this is kind of the free account. So we have a COVID bucket and my core information bucket. There are a bunch of other buckets that we can initialize for you guys. If you need anything else, please let us know. We can make those available. But this COVID bucket we've kind of created in conjunction with things from the IAFC, Johns Hopkins, CDC, World Health Organization, and obviously knowing and understanding our customers and working with our customers. So if I press edit, I can let people know if I'm single family, live in an apartment, an assisted living facility or healthcare facility. So if I came in here and said, I'm actually in an apartment and I have 3 people living in this apartment, I can come across and say, yep, there are some people here who have some sort of either high risk item or some sort of functional need that we need to be concerned about, right? So I can put these, just check off as many as we have, anyone in the household who has these problems. And I can put additional information as well. I can also say whether or not someone has tested positive or had symptoms. If any of these are yes, then we will get a little question that says when did symptoms start. We can put that in, and we also have some other information. So if both of these are no, but someone has come in close contact, we can put that as a yes. Or if I'm just simply isolating or quarantining, and it gives you some definitions of what those are. So just a really basic form, but just with a lot of powerful data. And we're going to show you what happens once I save this and then make it available on the other side. So when I press save over here, that's saved that COVID profile and made it just really simple and straightforward for me to sort of collect that information. So it should take 2 minutes, 3 minutes to create an account for a resident. They claim their household and they're done. Now, the beautiful thing here is that we will confirm their email address. They'll get automated emails from us. And over time, as data is changing, we are emailing them to keep their account fresh. So this happens on the COVID side. It also happens on the other data, right? So if someone has moved, someone's moved locations, we provide them a nice email that allows them to say, hey, it's been a certain amount of time since you've reached out to us, or it's been 14 days since you since you started showing symptoms. Do you have anything to update in your COVID profile? the will send them emails to ask them, have you moved? Are you in a different location? And it gives them a very easy way for them just to manage that data themselves. Now, in certain circumstances, if people don't respond and that data is likely stale, then after a certain amount of time, we actually deactivate the information. So it's kind of automating and making it very easy for you guys to manage data without having to actually manage the data, because we're doing it ourselves from a workflow and automation perspective. So this is kind of, think about this as the life safety profile of the resident, but can also be for commercial buildings, can also be for nursing homes and healthcare facilities. So once that's done, it's put in the system, that's all the resident sees, that's all they have access to, just the input side of the equation. But what happens then on the public safety side? Well, obviously, when you guys first log into First Do from a public safety perspective, you're not going to see a lot of data. The reason why is because you're going to need to get this out to your community and have them begin to sign up, which is the process we just walked you through. But let's imagine that people have started to sign up, which they actually have. I'm going to go into the First Do, logged into the First Do application here with my username and password. So what you'll see on the map are these little map markers. Green means everything is good. Blue means that there's some sort of access and functional need or high risk element. Red means that someone has tested positive within the last, and symptoms exhibited within the last 14 days. There are a few other colors that we'll share a legend with you guys in a moment. But essentially, this allows you kind of across the country to see some of that critical data and information, right? So as people are self-reporting, and this is only available on the public safety agency side. If you guys want to work with us to do anything else, this is really just a simple map. We're going to show you kind of some things that you can do right now. But if you want to integrate to dispatch, if you want to filter around your area from a shapefile perspective, we can do all of those things. So please reach out to us and we'll figure out if we can set something up for you really quickly. Let's come across here and actually zoom in on that profile I've created. And I'm just going to click on it very quickly. And then we're going to come back and we're actually going to talk about the layers in a moment over here. So you can see the little layer button on the right-hand side. Right now, the base maps layer, if I come across here and I show you, we have some layers, hospitals, nursing home, John Hopkins data. I'm going to talk about those in just a second. With me, let me just zoom in here. Let's click on this, for example. I need to refresh the page. Maybe perhaps I'm logged out. Do that. Right, perfect. You can see it's going to just zoom me out to the extent of the US. Just going to zoom in here. This is going to show you the some of the self-reporting that's happening. So I can turn this off at any time and just come in here and turn it on. And what we're actually going to do is talk about some of these layers on the right-hand side as well. Not created that account in the right place. Just in a development environment here, so it's not going to see everything the same as you would see it in production. One second, everyone. I'm going to log into a different account.
And guys, Andreas, and while Rami is doing that, there was just a couple of questions that we might answer real quick. There was a question around how we were talking about automatically updating the data and reaching out to users, how much time until deactivation. And so it's configurable by account. Oftentimes it's a 6, 9, 12, 15-month process. That's just based on your community and what along with we bring best practice in terms of those touches, and you can also augment those over time. Looks like Rami just got that back up, so I will pass it back.
Okay, great. So yeah, you can, as you can see, you can just see some of that data on the map. Again, this is in a development environment, so it's going to work differently for you guys in production. So if I come over here to the layers, if I also wanted to kind of expose some different layers on the map that are coming from different data sources, we have John Hopkins case data over here. We have nursing homes that we can show on the map across the entire country. We even have hospitals that we can turn on. So it just kind of allows you to use a bunch of, we're going to be adding additional layers for you guys that might be helpful at this time. But then obviously the self-reporting layer that's available to you that you can easily click and access that data information. We'll come back to this in a second when I'm in a live account, and we'll show you some of the, oh, here we go. So we have some of the critical information, like the fact this is an apartment, three occupants, immune compromised, asthma, limited mobility, so any functional needs we have to be worried about, and the fact that this is a confirmed case, and you can see that by the map marker as well over here. Second, the map marker being red and blue. So any other self-reporting will be available on the map. What we can also do is, let's come across here. This data, obviously you guys won't have access to all of this from a public safety perspective, but if you would like this data pushed to your own Esri map, we'll just come across here. Let me just open that up in a new tab. If you want any of these feature services pushed to another layer, we can create a feature service. This is actually one that's available in our account, but we can integrate it into your own ArcGIS account. So we can make it available to you right within ArcGIS. So if you're already using tools and you don't want to have to log into First Do to access it, you can just push it right into your own, Esri ecosystem. So you can use it from that perspective as well. Great. Just jump back to map for a second.
And for those out there who don't necessarily have GIS resources or a GIS department or analyst right within your department, we're going to be building out. We'll be there also to help, and we'll be publishing a dashboard that will help you as well.
Yeah, exactly. So we're going to be working on building out that login to First Do, which is going to have a dashboard with more like an operational dashboard that'll have counts. You can filter by county and start to really get access to some of the cool information that's there. But again, like Andreas mentioned, if you do have a GIS department that wants to play around with this data, you can definitely integrate into your own GIS ecosystem. Couple other points before we hand it over to Dan. Like we said, if there's anything else that you guys require, if you want to integrate this to dispatch, if you want to find ways to perhaps collect your own information from a pre-planned perspective, all that functionality is available in First Do, but just not part of the rollout that we're doing on a national level. So just stay in touch. We're going to be reaching out to everyone individually and working with everyone individually to make sure that this works in the way that we kind of expect it to work, and trying to make it as national a rollout as possible. The second point as related to that is we are going to be rolling this out not just to fire agencies and public safety agencies. We are going to do our own resident-facing rollout. We have a go-to-market plan there to get residents all across the country to sign up. And if we do get a sign up within a jurisdiction who hasn't accessed an account yet, we'll give them access straight away and let them know that they have residents who are self-reporting in their area. So we're going to be very close to this, and we've got a team who are kind of working on this full time. And again, this is all available at no cost to everyone. So those are just the two kind of final points around the workflow. At this point, I kind of wanted to introduce you guys to Dan Flynn before we jump into some questions. But Dan Flynn, like we said, is the division chief over at Asheville. When we first built Community Connect, he was probably one of the most instrumental people in helping building that out. And I won't steal his thunder too much. I'll kind of let him walk through that story and to talk to you about the importance of kind of using this kind of self-reporting tool at this time. So Dan, did you want to jump in and say a few words?
Yeah, thanks so much, Rami. Again, my name is Dan Flynn with the City of Asheville Fire Department. We're in North Carolina. We had this idea come up during Autism Awareness Month, And we had First Due and began to process that and think, well, how neat would it be for families who had an autistic family member to be able to provide information to first responders before they arrive on the scene. Reached out to the folks at First Due. They said they've got a Community Connect. They thought they could adapt Community Connect for that purpose, and it blew up from there. So instead of just being a functional needs, it became sort of a kind of a residential pre-plan. One of the things that you have to know about First Due is, Community Connect is part of the First Due platform, and the First Due platform gives you pre-plan information on every rooftop in the area that you respond to. That includes residences, all the way up through commercial properties, and it gives you a base level information depending on how detailed the county record system is. But anyway, so the Community Connect provided a way for folks to log in and provide that information. So we built that out. We expanded the functional needs to include contact information. We wanted to address fire life safety education a little bit. So we used that opportunity to describe what a meeting place is, and also to be able to provide that information to first responders, where the meeting place is outside your house, structure information. You can upload pictures of your pets, which is amazingly a huge part of this, is to be able to let folks let us know where the pets are. Also, access to the property if there's difficulty, if there are any access challenges, gates or whatnot, you can provide gate codes. But the most amazing thing for us is that we were able to convince our county. So the city of Asheville, of course, a municipality, and so we have 18 fire departments that surround Asheville, and they are all on board with First Due Size Up. So if you can imagine, of course, the 18 county and then the one city makes 19 fire departments responding, being able to have access to everybody's pre-plans. So anytime county departments come into our city, or anytime the city responds into the county, we have access to those pre-plans. And Community Connect is certainly a part of that. So as we roll out this model for the city of Asheville and Buncombe County, which is our county here, when anybody that's responding in the county will be able to have access to this Community Connect information. So my purpose here was just to kind of give you an idea outside of what they're doing here for the COVID response. It's really just been, you talk about a game changer. This is a game changer for pre-plans and first response. One thing that I wanted to mention also, that remember, Community Connect is part of the First Due platform. One of the things that was so important to our county was having a functional needs registry. We had one in place, or they had one in place before, that it was really difficult to manage. The data became stale, to use Rami's term. It was very difficult to access. Once we get people registered, not just for COVID, but we get them registered for all of their functional needs, there's a component of First Due called the Occupancy Organizer, and you can filter by functional needs. If you needed to see everybody in your area who is registered that has asthma, you could filter by that and then plot that information on a map, and then you could know exactly where all those people were. One of the biggest parts of this for us, the COVID releases, is not only identifying cases to protect first responders, but also to identify high-risk individuals. So if we get to a state in our city where we're on full lockdown, first responders will have access. We can sort out where the high-risk folks are and potentially reach out to them. Again, we're a relatively small county. I don't want to get it too detailed, but we could sort it out by functional need, identify the high-risk people, plot them on a map, and then reach out to them. But just to be able to filter through the data and to be able to put that data on a map, it just speaks volumes. That's about all I have. I'll be glad to take any questions. If they get any detail, then certainly we can provide contact information and talk offline.
Great. And Dan, thank you so much for that. And just to reiterate a couple of those points, we don't want this just to be a simple, small software solution that you can kind of use to collect a little bit of information on someone who might say they have, if this is aimed to really be released across and to become an integral part of the infrastructure in the fight against COVID-19. So the great news is for existing customers like Dan, how he mentioned that they're using First Do and Communicate for a bunch of different things. But now with this release, they're going to have access to that COVID bucket, and they're just going to be part of kind of the overall ecosystem of self-reporting and analyzing critical information and data. And Dan said a really important thing, which was it's not just about those who are sick or might be sick, but it's also people just letting first responders and emergency operations centers and emergency managers know where that high risk and access and functional needs community are, because as this problem progresses, there's going to be a lot more that we're going to have to deal with, and understanding where the most vulnerable community are, not just from a COVID perspective, but also just from a mobility or some sort of functional or access need. That's going to be crucial in the next few months. It's going to be, and it was crucial before this crisis, but at this time, I think it's just becoming even more valuable. We do have a couple of questions, Andreas. I'm not sure if you saw some of the questions coming in. I think maybe at this time, it might be good for us to jump into some of those questions.
Yeah, for sure. Let's jump in and do some Q&A. Jeff, did you see it? Let's see here. Okay.
Yeah, I've got the questions here, so if you're ready.
Sure.
So the first one is, what happens if people try to claim the same address? I guess what somebody's asking there is, is there a deconfliction part of the addressing?
Yeah, totally. So the system will actually allow only an address to be claimed by only one person. So if someone tries to claim an address that's already been created, it will let them know and then give them an ability to kind of make a dispute or say there's a problem or issue here. So it doesn't allow for that conflicting information. However, if there are units within an apartment block, it will support those secondary addresses.
Great. That's a good comment. I know that a lot of folks within this response are living in apartment complex, condos, high rises, things like that. So that's good to know that you've got that thought through already. The next question is, what happens if people, how much time until the deactivation takes place?
So I think Andreas may have answered that a little bit earlier, but that's really just set up at the account level. The deactivation on standard Community Connect, we send reminder emails over a 12-month period out to usually, and then we send the emails out over a month after that 12-month period, and then we'll deactivate the account. Now on the COVID side, we're sending things out more frequently. Just to update information and data. So requesting updates on certain things. Now we already have in the form some detail around timing. So when symptoms first presented, and as a result of time going by, we actually changed the way the data is presented in First. So there are a couple of measures there on how we can make sure data doesn't get stale.
Okay. Our next question is, for those with access to the existing fire department First Do systems, do we need to sign up separately for Community Connect and link the accounts?
If you are an existing First Do customer, our client success team is actually going to be reaching out to all of you guys, but you can reach out to them as well. So just work with your account manager and we'll turn on Community Connect for you guys straight away. So they'll actually work to set it up in your existing First Do account.
Roger. Next question is, how do you get the community to buy in and self-report?
Yeah, so hey, it's Andreas. So in that email that Rami showed you, there's a whole bunch of instructions that will be included as related to that. But the broader message, that we're looking to push out to people is that this is very much, in line with a big movement that's going on today in terms of do your part. That's related to stay at home. To stop the spread. But this is obviously this is a very complicated problem, and we want to continue on with what people are really grasping onto, which is to do their part and help out the first responders better protect themselves and better protect the members of their community. And there's a full set of instructions on how to help you do that in that email.
Great.
This
I
is
follow
Dan.
on.
I'm sorry. This is one. Just wanted to add, just from a personal experience, we partnered with our local media, and they were very gracious in doing kind of we kind of did a help us help you campaign. Help our fire department's here for you. Help us help you, and this is one way to do it. And so that we got the largest influx at that point, and so that's what I imagine that we'll do again is we'll engage the media, engage all of the outlets to be able to get this information out.
Hey, Chief, that's great. Hey, a follow on to this from our ISC staff here for the First Do folks is, could you provide a flyer template that they could drop their logo into and be ready to push out in emails or social media or to put up in flyers or things like that in communities?
Totally, and that's all part of the package that we send over that includes all that content. It also includes flyers that can be printed, handed out. So there is and we'll also send you some examples, like Dan mentioned, examples of some media content that have been, done by the City of Asheville, Eastside Fire and Rescue, and Fort Lauderdale, just to talk, just so you can, it's something you can very easily share with media agencies and say, hey, we'd like to do something like this here. Here's a quick flyer. And usually the media outlets are very receptive to that. But yeah, to answer your question, Jeff, all of that is included in the guide that we send over, how to release this stuff to your community.
Great. Next question is, does the department need to be a customer already to get access to this app?
Go ahead, Andres.
No, they do not. What Rami just showed in the demonstration is available totally for free for any public safety agency, health official agency around the country. So the process that we went through was, you'll go to this public safety, what's on your screen, the URL, the website, and there's a form. And so you'll fill out that form and hit create free account now. And that is your action to request access. We just simply verify that you are actually a member of a public safety agency, and then you'll get your login credentials plus all those instructions on how to get the word out to your community.
Great. Next question, can I secure my local data and only allow my agency to access that data so it isn't shared nationally by default?
Yeah, if you'd like to kind of restrict data information to kind of your area, like we said, just reach out to us once you're all set up, and you can provide a shapefile that we'll import, and that shapefile will define your boundary and kind of your jurisdiction. So we can work with you guys on that, plus a bunch of other things as well.
Great. Where does the hospital and nursing home location data come from?
So yeah, we can provide that. Those are kind of global layers that are provided by a bunch of different data aggregators. I believe those ones actually might be published by Esri, but I'm not sure, and I'll have to have another look. But you'll have the link to those. If there are other layers that you guys want to provide, just let us know, and we'll actually import them into the account as well. So these are just layers that help seed the account with some critical information data that you might want to, that might be valuable at this time, just so that there's more things for you guys to use, more tools. Actually, sorry, I just got sorry, Jeff, that's from the Department of Health and Human Services.
Great, thank you. We had someone that came in a little bit late. Can you talk just a little bit more about the community-facing dashboard or view, if there is one that communities would be able to see? I know in a lot of the data that you do, it is very specific and very geocoded down to the actual building, but is there plans to do something on a community-wide basis, maybe down to a zip code or a county level, that would be a community-facing?
Yeah, possibly, yeah. We're going to have to think through that a little bit, but the good news is that if a jurisdiction wants to communicate to its residents, they can take that data that's being pushed into Esri, and then they can kind of do whatever they want with it. So if they want to group data by zip code and provide information just at a more general level to give people some understanding of some of the things that are going on. As we start to learn what some of those things are, we'll start to build some of those dashboards, and maps for those other people that don't necessarily have GIS departments to work with. So we'll create those as standard as we figure out what those are.
Great. We've got a question about integrating to the dispatch center, and I know that First Due has done a lot of work with all the major CAD vendors out there. And so can you talk just a little bit about your work previous to this that gives you that ability to be ingested by almost every CAD that's out there?
Yeah, absolutely. Andreas, did you want to answer this, or do you want me to jump in?
No, why don't you go ahead?
Yeah, great. So First Due as a platform, like we said, is a pre-incident planning mobile response solution, as well as a communication platform. So it's every single customer that we've brought on board across the US, from Charlotte to Seattle to Fort Worth, Fort Lauderdale, Asheville, all of Buncombe County, all of Mecklenburg County. We've got kind of customers all across the country. All of them that have come on board we've integrated with Dispatch, and we do that in a number of ways. The simplest way is by is via email. So just an email notification to our system, which we pass out, and we create the dispatches on our side. So it's a really simple thing for us to do. It can take minutes, and we've done it with almost every CAD in the country. So when it comes to actually integrating with CAD, that's something that we can work on if required.
Good. And in that allows mobile computer devices to actually pick that up as well. So in your truck or in your ambulance or whatever police car, is you will be able to see that also visually, just like you do your hydrants or other things in your your response areas. So
totally. Yep. Exactly.
Good. Oh, great.
Can I add one thing just from a user perspective on that? Just a very interesting thing, the way ours is integrated. This is Dan again with Asheville Fire Department. So there's also an app that works on cell phones, and the very interesting thing that we found is that this has decreased our turnout times, because the notification through First Due comes out probably 10 to 30 seconds before our tones hit, and so people are moving to the truck before. Because they hit their notification pings, and they're heading to the truck before the dispatch even happens. So I just wanted to add that was a pretty neat unforeseen benefit.
Great point there, Chief. And yeah, this is something that, as we look at this event, but even going beyond just this event, there's a lot of this data sharing that, because of the way that First Due structured their system, is able to seamlessly do that transition of data back and forth to all kinds of devices and all kinds of platforms, which makes it very nice. Our next question is, can you send out an email about this free Community Connect for COVID that I can then push out to my neighboring departments to get them to sign up around me that might not be able to join today's webinar?
Absolutely, yeah. We'll provide you some standard language that we use to kind of explain it, a link to that landing page that you can also pass across, and we'll also have a recording of this webinar that we're actually going to put into that web page. So yeah, you'll have something really simple that you can pass on to your neighbor agencies.
Yeah, and I would just quickly add to that. Feel free to reach out to us directly as well. We're more than happy to help anyone and everyone with this initiative. So don't be shy.
Great.
Thanks.
So let's just recap a second about it. So we're taking an existing platform and we're altering it just a little bit to respond to the COVID-19 emergencies. But I think going forward too is we might be laying the groundwork for even broader capability than just the COVID response. And so I think as all y'all that are on the webinar today, as you look at this and you get more information and go to the web page and get them to contact you, is also you might be thinking about other ways to use this. I know one thing in the IAFC working with First Due is they are very open to what's the true needs of the emergency response community. And as part of the Technology Council, they've been very instrumental in linking other technologies together, which is very important for us. I know that within the technology community, things change very rapidly. And so being able to spin this system up and adapt an existing tool to meet the new challenges that we're facing today, I think is pretty cool. And so we really do appreciate the folks from First Do, doing this for us, because again, this is a tool that is going to protect first responders when you know that you're going to an address where a person that you might not have had any other information about, that you're going there because they think they have COVID and they self-quarantine themselves. That gives you a better heads up. It's almost like if you had eyes on a camera looking at that scene prior to arriving on a structure fire. So I think this is pretty cool. And I'm going to turn it back over to Andreas now to kind of wrap it up with some finishing things and then last thoughts. So Andreas.
Thanks, Jeff. And thanks everybody for all the thoughtful questions and spending, 45 minutes with us on this. We're really excited about where it can go and what it can do for everyone sort of right out of the gates. So please, as you have feedback, as you have questions, please feel free to give a call, reach out. We want to continually improve it over time and make sure that we're, giving you all everything you need to stay safe out there and just make your lives easier while you're doing a really difficult job. Thank you all.
And Andreas, just to kind of expand on that, we looked at this problem, we looked at our existing platform, we spoke to some customers, and we put together, what we thought was the fastest and most comprehensive solution that could be deployed across the entire country very, very quickly. As we roll this out, we're going to learn a lot more about what's helpful at this time, but it's, we are 100% focused on working with our customers and working with public safety agencies who are not even our customers to solve problems in this space. And this is one of the biggest problems that we're going to face, not only now, but for the next few months, if not the next year. So, and the impacts of it. So just really excited to get this out into people's hands, start to develop feedback, and please do not be shy. Call us, email us, give us your thoughts. If anyone on this call knows us, you know that we're excited to build new technology, especially new technology that makes an impact. So feel free to reach out anytime.
Well, I want to thank everybody who attended today's webinar. And remember, you can visit the IAFC webpage to get the latest on the coronavirus task force's operations. And we have 2 dashboards on there, 2 surveys that we're doing. One about the impacts to the fire and emergency services from the coronavirus, and then also a questionnaire on the PPE use and what are your highest demands. So please take a minute each day, go to those websites, fill those surveys out. We're trying to take a pulse every day of what's happening in the country and what our true needs are. I want to thank the folks from First Do today for their participation in the webinar and showing us this great tool. And thank you very much for everybody to attending. And if you have friends that want to join in again for next week, we're going to be doing a second webinar. And at that time, we'll also be presenting on some of the aspects of what's happened over the last week with people signing up. Remember too, you can go that the recording will be available on Monday on the First Do website. You can go and click that and share that with your friends in other departments and surrounding mutual aid partners. So thank you very much. Everyone have a safe and clean weekend. Be sure to wash your hands and take care of each other out there. Thank you very much.